Hello, and thanks for joining us. Welcome to the 2022 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is type 2 diabetes and cardiovascular disease risk. My name is Carla Cox, registered dietitian nutritionist and certified diabetes care and education specialist, and your host for today's event. Our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press star 3, that's star 3 on your keypad, and an operator will collect your question and place you in a queue so that you may have the opportunity to ask your questions live from our experts. To participate online, type in your name and question in the fields below the streaming player. Press the submit question button and your question will come directly to us. Stay with us through the hour and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in a short survey at the end of the event, so please stay with us. Okay, now a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart. With support from founding sponsor Novo Nordisk, as well as national sponsor Bayer, the No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. When you have diabetes, it increases your risk of heart disease and stroke. Make sure when you see your doctor, you talk about your risk and work toward prevention. Okay, so I'm very happy to introduce our guest for today. Starlyn Hayden Grading serves as the Illinois Pharmacists Association Director of Clinical Programs and Population Health, working primarily to create and establish community-based chronic condition and comprehensive medication management programs to improve person-centered care and medication optimization. She is the network coordinator and sees patients for the diabetes, prediabetes, and cardiovascular health programs. She practiced as a clinical pharmacist for 10 years and 17 years as the Director of Quality Assurance Drug Utilization for Illinois Medicaid. She is an expert in the field of healthcare outcomes research, drug use analysis, and reimbursement. And I'm delighted to say she's a colleague of mine with the American Diabetes Care and Education Specialists Research Committee. Dr. Eduardo Sanchez serves as Chief Medical Officer for Prevention for American Heart Association. He is the principal investigator of the National Hypertensive Control Initiative, a cooperative agreement with the U.S. Department of Health and Human Services, Office of Minority Health, and Health Resources and Services Administration. He is the American Heart Association clinical lead on Target Blood Pressure, a joint blood pressure control initiative with the American Medical Association and No Diabetes by Heart, a joint cardiovascular risk control initiative with the American Diabetes Association. Dr. Sanchez is a residency-trained family medicine physician and a public health physician. So, Starlyn, do you have anything to add to that?
I would like to say that I truly enjoy working as a diabetes care and education specialist, and in particular, a lifestyle coach in the National Diabetes Prevention Program. So that's part of my key focus right now in my practice.
Cool. And Dr. Sanchez, would you like to add something?
Sure. I did my family medicine residency training in San Antonio, Texas, and learned type 2 diabetes care on the front lines with my patients, where not only did I need to know the science of blood pressure control, but so many of my patients only spoke Spanish that I had to put my language skills into play. And so it's just the reminder that context matters when you're taking care of patients, and knowing the situations in which they live, their belief systems, et cetera, and so on, have to be part of taking the science and putting it to work.
Very good. Thank you. Thank you both. And as we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. Dr. Sanchez, to you, could you please spend a few minutes setting the stage for today? What are the increased risks of developing heart disease for a person with type 2 diabetes versus one who does not have diabetes?
Sure. Would love to talk about that. First of all, you mentioned earlier that type 2 diabetes by itself is a risk factor for cardiovascular disease. But the other, I think, important thing to remind everyone of is that the things that most affect from a mortality perspective, the things that result in the death of persons with type 2 diabetes, at the top of the list is cardiovascular disease, and in a close sort at the top are stroke. So it's critically important that persons with diabetes understand their cardiovascular risk factor. Just 2 weeks ago, the American Heart Association released a updated scientific statement, pardon me, Life's Essential 8, an update of what was Life's Essential 7. I'm going to tell you what those are. From the perspective of the American Heart Association, those are the risk factors that are largely modifiable, that you can do something about them, that contribute to cardiovascular health on the one hand when you're good on those things, but also contribute to cardiovascular disease when you're not so good on those things. 4 are in the category of health behaviors. One of them is healthy eating. One of them is regular physical activity at recommended levels. One of them is avoidance of nicotine or avoidance of exposure to nicotine. And the 4th, which is new, added to the 7 that had been preceded, is sleep. Good duration of sleep, 7 to 9 hours for adults, more for kids. And then there's 4 behaviors. And I'm going to put diabetes, four health factors, sorry. I'm going to put the diabetes last. So in a different order, weight as measured by body mass index, one's blood pressure, one's blood cholesterol, and lastly, one's blood sugar. And the degree to which those 8 things are optimized is the degree to which any one of us is going to live a longer, healthier life, irrespective of what's going on. So the one thing about Life's Essential 8, never too late to start, never too early to start. Those 8 things contribute to cardiovascular health, cardiovascular disease. And a person with type 2 diabetes has one of those risk factors for sure, in addition to any other combination as compared to somebody who does not have type 2 diabetes. So Carla, I got there a long way, but I did a lot of explaining along the way. That's the answer.
That's great. And Sterling, why don't you, I think that was wonderful setting the stage. Why don't you give 3 tips on, okay, so we want people to exercise. How is you as an educator get them motivated to do so or help them find the way? So can you lay 3 lifestyle things of how you do it? Yeah.
Well, sometimes that word exercise is not an easy word for some people to take in. So we try to say move and be active, which means, it depends on your neighborhood. You have to take that into consideration. Not everybody can walk 3 to 5 miles around their neighborhood. So you have to find, based on their culture and their background and where they live, something that can keep them moving. I have, in this past COVID, I had persons with diabetes do Zumba. So Zoom, and got their groups of friends together on their Zoom if they had the technology. Some walk and talk using their cell phones. They may not be able to meet together, but they get their groups of friends so that they can have, walking is the cheapest form of exercise. And the other one would be, vacuum your house is extremely active if you have a vacuum or you have a broom. So that gets your arms involved, that gets your legs, and then, turn on some music and vacuum to the music if you can hear it. One thing I wanted also to point out is we also try to encourage, if you are smoking, to try to quit smoking as one of those healthy behaviors. So we try to move people slowly through that process of cutting back on their smoking and trying to quit.
Great, thank you. If you're just joining us, welcome to today's Ask the Experts event, Diabetes and Cardiovascular Disease Risk. As a reminder for you, those of you on the phone, press *3, that's *3 on your keypad, and an operator will collect your question and place you in the queue so that you can have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the stream player. Press the Submit Question button and your question will come directly to us. Remember, today's topic is diabetes and cardiovascular disease risk. So let's remember to focus on that topic for today's event when asking a question. Okay, so now let's take the first question, and I think this is going to go to Dr. Sanchez. So it's coming in live. It's coming in from Macon, Georgia.
Hi, my question is, I have a right bundle branch block, and I'm trying to find out if it's because I'm a diabetic, or can you tell me, like, I don't know how I got that.
Sure. I thank you for the question. I am hopeful that you are connected with a primary care physician and maybe even a cardiologist. And the relationship, I'm not sure that I could answer that question satisfactorily, only because right bundle branch block happens in persons who do not have diabetes. As well as in persons who have diabetes. And off the top of my head, I honestly don't know if there is a increase at all in persons with diabetes as compared to persons without diabetes. But would say equally important is making sure that you are connected with a primary care doc and or cardiologist, endocrinologist, and that all the things that need to be done to control those modifiable risk factors on the one hand and manage your right bundle branch block on the other hand are being addressed. And the three critical areas where there's opportunity, one is making sure that your diabetes is being managed. The good news is that there are now
Okay, we've lost Dr. Sanchez in his voice. So
medication.
There it goes.
Talking. I'm back. So I think I was saying blood glucose, and there's some great new medications in addition to the ones that already exist that are cardioprotective. Fancy way of saying they provide not only glucose control, but help protect your heart. And then also blood pressure control, very, very important. And making sure that you are on a lipid lowering agent, all of which can help protect your cardiovascular health despite your right bundle branch block.
Great, thank you. Sterling, I think this one's for you. This one comes in from Alpha Richards from Yucca Valley, California.
Yes, my
Alpha,
question.
you're on the line. Yeah.
Yes, Mike. I heard you say walking 3 to 5 miles a day, and I have been walking consistently. It's been over a month, and I walk up here in the high desert. Yucca Valley is in the high desert, and I'm in the mountains, so I'm on all sand most of the time. Sometimes I'll walk other places, but I've been very proud to be consistently walking, and I'm a pre-diabetic. Usually, instead of trying to keep up with 3 to 5 days, because I mark it on a calendar, I try to walk every day. But if I'm wiped out because I've stretched or worked out, I may not, because I have back problems. And that's another concern with the vacuuming. Anytime I vacuum, then I've got to go work my back by doing Cobra or lay on my pad. So those are, I apologize for lumping them both together, but I'm feeling 20 minutes a day at least when I walk. I'm walking 20 minutes or more is sufficient. And, the back with the vacuuming.
Thank you. So I guess the question is, Darlin, is 20 minutes most days of the week good?
Yes. Well, what you're trying to do something daily, trying to move daily. There's a new study about trying to get at least 150 minutes in a whole week. What I was saying is some people think you have to walk 3 to 5 miles. Some people can do that. Not everybody can. You have to adjust your movement and exercise based on your ability. There's also chair yoga that helps you stretch out those back problems. I'm with you, girl. I've got some of the same personal lower back issues, but I'm also very impressed with the fact that you are stretching and you're keeping track of everything. That's probably the most success right there, is the fact that you're scoring and keeping track of every day the kind of movement you're doing, and you're doing different things. You don't always have to do the same thing all the time. But my daughter used to live in your area. She was with the Air Force. She just moved there, but we have maybe walked some of those same trails. They're wonderful, and they're not all flat. Back here in Illinois, we have lots of flat land. And so that gives you more exercise and helps your heart pump even better. But with that low back, the stretching and being able to discuss with your team, you should, at this point in your pre-diabetes state, have a good team. You should have a good primary care physician. You should have access to diabetes care and education specialists, and a pharmacist and a dietitian, and you probably have some access to physical therapy or occupational therapy through your physician. Could set that up, that help you do the right stretches to help that back out. I think I covered that. But I'm very impressed with how she's already walking.
Yeah, that's great. So, Dr. Sanchez, this one's for you. It comes in from Valerie, and she's from California.
Hi, I'm 69 years old, type 2 diagnosed maybe a little over 20 years, and my parents both had cardiovascular problems, including bypasses. What would be the range for my blood pressure? What's my goal, do you think?
So I won't opine. I will give you the facts. Your blood pressure goal is below 130/80. And let me just say, you're 69 years young, and you have some clues about things that you ought to be paying attention to, because both your parents seem to have had. Yeah, I warned you guys I was going to have trouble, and I apologize, Carla and Starlin, but let me just jump in and say, so blood pressure 130/80 or below that. And the key things are these Life's Essential 8. They apply to you, ma'am. So healthy eating, physical activity, as has been discussed already. That could be anything from walking to dancing. And I guess if you're having low back pain, find someone else to.
Okay, thank you so much. You might want to call in on the phone bridge too, and then we'd hear your whole statement.
Vacuuming.
Yeah, great. Okay, next question's coming in from Chris, and this is for you, Starlin, because it's a pharmacy question. So Chris is calling in from Gaithersburg, Maryland.
Hello. Hello, can you hear me? There's seems to be a problem. Hello?
Yeah, we can hear you.
Okay. Well, I'm a type 2 diabetic and also high blood pressure I have, but it's under control after taking amlodipine, which I've been taking for the past 6-7 years. And it's controlling it very well. But reading through the internet, they criticize amlodipine for its side effects. They say it does not really protect the heart and things like that. Is it just to promote their own product? It's a marketing gimmick. I'm pretty happy with amlodipine. Tell me, I would appreciate hearing it from you, sir.
I'll jump in and say, It's really important you have a conversation with your doctor about this. If a medication is working for you, that's critical. That's the most important thing. Um, um, uh, uh, and again, I think the critical thing are blood pressure control, blood glucose control, cholesterol management. If the medication is working, this is one of those areas where I would say, if it ain't broken, don't fix it. So I'll stop there. Starlin, what do you think?
I completely concur. So when you're doing well on a regimen that has been you've worked through, you said 6 to 7 years that this has been. If you were going to have any of those critical side effects, it would have happened in that first 2 years that you started taking amlodipine. And maybe over time, when you discuss with your doctor, if your blood pressure goes up a little bit or your blood sugars are out of range, they may move you on to an additional med. But that's between a medication, but that would be between your team, your healthcare team, on how you're working through that. The fact that you taking your medications every day and keeping your blood pressure down and keeping your blood sugars down, you are ahead of the game. That's excellent, and I would stick with that regimen until something changes in your life. And sometimes as you age or as we go along, we may need to switch medications, or unfortunately, PBMs, they're not going to take amlodipine away, thank goodness. But sometimes those pharmacy benefit managers or healthcare gets in the way, and we have to rearrange your meds. But you're doing great, and keep doing the regimen that you have been put on by your physician.
Very good. Thanks. So we have an online question coming in for really either of you. How is sleep related to diabetes?
Do you want to go first, Dr. Sanchez?
About a decade ago was really difficult. We didn't have enough science to know the relationship between sleep and heart disease. So I'm going to talk about heart disease first. It is very clear that sleep has a inverse quality of sleep, length of sleep has an inverse relationship with weight management on the one hand, blood pressure on the other hand, and weight in many people, excess weight is the pathway to type 2 diabetes. And then when we add to that sleep as an indicator, sometimes poor sleep being an indicator of stress and or anxiety, there are those relationships. The science is compelling enough that, as I mentioned earlier on, the American Heart Association is now categorizing sleep as one of the essential factors for cardiovascular health. And so whether it's direct or indirect, there is a relationship between sleep and diabetes. Starlin?
So with diabetes, well, first of all, sleep is your way of your body resting and healing all the stresses and things that you did all day. It, like Dr. Sanchez talked about, blood pressure and the cardiovascular, and your kidneys can start pulling out the toxins, and about your liver has to rest because it's been working all day, making sure that you have the right kinds of insulin and blood sugar control. So it works. It's an organ that works very, very hard. So when you don't sleep, you're not giving all these essential organs that all work together to make you healthy a chance to regain, revive, and relax. And if it's always under stress, then the organs start wearing down faster. So if you remember how some people get sleep deprived, I did a study with people that rotated work on. They were on days and then they were on midnights, and we watched their blood glucoses and we watched all their critical metrics, but the hemoglobin A1C, we watched that A1C go up when they were working midnights because they preferred the day shift over the midnight shift because it disrupted their sleep. So when you are not getting into a good sleeping pattern, then you're not allowing your body to heal itself. And so it wears out those very essential organs that control your blood pressure and your heart and your liver and your lungs and your kidneys. What is it? Do we have 11, 12? Your brain, you got to let your brain rest. All of the organs all work together, just like a car. Parts of a car work together. And so sometimes that car, if you just drove it 24/7, it wouldn't last very long. So think about your body being like a car.
Great. So this question is coming in online as well. It comes from Teresa in Dallas. And Teresa says, I have type 2 diabetes, I have high blood pressure, but also struggle with low blood pressure when I wake up or go walking. It's a challenge. I tend not to want to take any medication because my blood pressure goes low, but I'm concerned about my chronic high blood pressure. My range is 130 or 160, and my low goes down to 68. Dr. Sanchez, you want to take that one?
I'm happy to give it a shot. I think you are a person who would benefit from specialty care. So there are hypertension specialists. And I'm going to stop for a second because I'm hearing myself and I'm sounding like all I talk about is doctors. And I want to be real clear. I'm a big believer in clinical care teams. As Starlin was mentioning, all the different members of the clinical care team, healthcare team that could take care of folks. Well, part of that healthcare team is sometimes recognizing that there's a need for some additional help. And I think that whether it's a primary care doc, a cardiologist, a hypertension specialist, or even an endocrinologist, there might be some value in doing what's called ambulatory blood pressure monitoring. And over the course of several days while you're wearing a monitor, seeing what is happening, how your blood pressure may be fluctuating with activity and or time of day, and then in a systematic way, go about finding the right medication or the right medication combination that's going to work for you. I do want everyone to hear yours is a particularly interesting case. It is not generally the case that folks have the kinds of issues you have, but the good news is that there are ways to try to ferret out the answer and ferret out a solution.
Great, thank you. Another call-in question, I think this probably Starlin, you'll want to answer this one, or write-in question rather. It's, I'm suffering from type 2 diabetes. I'm facing a huge weight loss problem. My muscle mass is going down too much. So her concern is what kind of exercises are recommended to prevent the loss of muscle mass while losing weight?
Well, I'm very happy that she's going the extra effort to try to get this in order. It is important when you're doing some exercises to ease into a weight bearing or strength bearing type of exercise to build muscle. The muscle needs more than your weight. So if you're losing weight, your body's used to carrying your weight. So if you can get some of the small handheld things that you can walk and carry the handheld weights. You start small and you start slow, and you always talk with your physician about advancing the kind of weight bearing exercise that you're going to do to make sure that you have the rest of your body is fit to add that more strenuous type of exercise. Also, those elastic bands, many places are giving them away as part of a I give them as an incentive in my diabetes prevention program. And they're very good because it's a resistance. You're using your own resistance to do that. Again, you should be able to have access to a physical therapist or an exercise therapist who would be able to walk you through the proper way. You don't want to add more injury to that. But the other thing is, I would go back to your team and make sure that the registered dietitian gives you a medical nutrition advice on making sure you have enough protein, because you can't really make muscle without protein. But that would be a Carly Cox question on how to work with your team and get a referral to a registered dietitian to help with that diet, and then also work with a exercise physiologist to key in the safe way to do it. There are many. After COVID, we have many programs that are online now that we can tap into and watch how to do some of those chair exercises using the retention straps, and then starting with those low weight bearing. It can be cans. Lifting your big bottle of Tide and doing it over your head. You don't have to go out and invest in anything expensive. You can use things right out of your pantry and start improving that weight bearing, and that will help get your metabolism to build more muscle. Carly, you want to talk about the protein?
Yeah, sure. I mean, I think a balanced food plan is the answer. And I think your advice because everyone's food plan is different, just like everyone's medication regimen is different. So I strongly recommend seeing a dietitian for your weight loss program. And that person, if they're a diabetes educator, may also have a lot of knowledge on exercise and what exercises will help you as well. And if not, should be able to refer you to an exercise physiologist or a trainer. So I would definitely go see someone that specializes in that, because everyone is unique. But yeah, adequate protein is important. Yeah, it sure is. Okay, I have an interesting question. Dr. Sanchez, at what A1C do diabetics start experience increased risk of heart disease compared to the non-diabetic population?
These are like board questions.
Yeah.
And I would say that if it's anything like hypertension, where quite frankly, once you get above 120/80, very small amounts of damage are being done. And as that blood pressure increases to 130 and to 140, more and more consequential effects are being had on end organs like your kidneys, like your heart, like your brain. And I would say that I would imagine, because I don't know the right answer to the board question, I would imagine that at a hemoglobin A1C of 7, one can begin to detect, maybe small, but one can begin to detect. And as you get to 8 to 9 and above, then you start seeing more and more effects on cardiovascular health. I would say that what we know about the good news is that what we know about prediabetes is that there are ways to prevent and delay type 2 diabetes. And so I would say, once again, a focus on, I heard balanced and comprehensive. I think that a focus on life's essential 8 and addressing all 8 of those factors, as opposed to any one of those factors, is the key to cardiovascular health, metabolic health, and a long, healthy life.
Great.
How's that
So
for dog?
That is awesome. And I think good advice. The lower the better in most circumstances.
Well, and I just
Okay,
want to
so
add that
yeah,
some people walk around just like they don't think their blood pressure is high because they don't feel bad. We have many patients who walk around with A1Cs that are like 6.5 and think they're fine, but they may be still doing some micro or macrovascular damage, and they're unknown. You may you may not have a full diagnosis of diabetes yet, but your eyes you need more glasses, your hearing starts getting duller. You may get some pains in your feet. So there's little telltale signs that let you know when you talk to your diabetes educator and your physician team that there may be some things to look at, and the number isn't always the telltale sign. It's more of the symptomology. So taking these questions to your team-based care group will really help you attack this early.
And
so
I'm going to add one more thing, Starlin. Yeah. Attacking early is those 4 lifestyle issues. The degree to which you're doing those at any stage, whether you're in that pre-diabetes, diabetes, pre-high blood pressure, those healthy eating, physical activity, not smoking, quitting if you smoke, and never starting if you haven't, and then sleep. The American Heart Association would say those are 4. I would add one more because it's essential for blood pressure control in the long run, and that's low or no use of alcohol. And I think that for weight management and even for progression to type 2 diabetes, alcohol can play an outlier role in moving things along unfavorably.
Thank you. I think to Starlin's note, the other issue so often happens is those things like having some problems with your feet, or your vision's getting not quite as good as it used to be, or you don't feel quite as good, you feel tired. Unfortunately, those are also things that happen with aging. And so sometimes people will just think, oh, I'm getting older, so I feel a little more mucky. And in reality, they need to just go have a nice physical with all the labs done and make sure that it's not something else poking its ugly head that we could fix, because we can aggressively treat things early, and then we don't end up with full-blown diabetes, maybe, or at least we treat it if it is full-blown diabetes. So I think be careful of that. I'm just getting older, so therefore go in and make sure you're getting checked up for all this stuff. It's important.
I think it's so important to say a few things, Carla, and that is, apart from diabetes and cardiovascular disease, there are a number of reasons why at least once a year we should be visiting our doctor. A flu vaccine is one of them. In this time of COVID, getting caught up on COVID vaccine. And as long as you're there, I might argue, there's diabetes risk assessment, cardiovascular disease risk assessment that will involve some measurement and maybe some blood tests that can really, really go a long way to separate out what's just the normal course of life versus what are some things that need to be addressed.
Perfect. And along that note, here's another question. Why is it important to discuss kidney health with the provider? Are there tests that should be included with an annual laboratory blood draw?
Well, the only thing I want to throw in before you start talking about the kidney is making sure that we start limiting our salt intake. We really are trying to get the processed food to lower their sodium chloride, which is salt, and trying to get on that low salt diet will help that blood pressure without, even better. And those of us that have been, taste your food before you add the salt on it, because restaurants my son's a chef. He says the first thing he was insulted by when he was in culinary school was the amount of salt and sugar that is added in order to get you to eat that food more. And so he's trying to be a healthy chef. So it's really important that we pay attention to our salt intake that goes along with all of Dr. Sanchez's advice on those healthy 8.
Yeah, and just along those lines, the best way to control salt is reduce processed food consumption, and the food that's in restaurants is too often includes too much salt. So those are two kind of additional insights, I think. Kidney function, two tests that ought to be getting done in the clinical care setting. One is a kidney function test just to see how well your kidneys are working, and the other is a urine creatinine test, which a urine albumin to creatinine ratio, which ought to be done once a year. These two are tests to assess how well your kidneys are working. The question is a great question because diabetes by itself contributes to chronic kidney disease. Hypertension by itself contributes to chronic kidney disease. And the two combined are a combination that must be paid attention to. And the thing is that once you know that you might be on the path, there are medications that can and should be used. And your physician can work with you not only to do those screening tests, but also to determine what are the right next steps. That's such a great question, because I think that one of the things I'd like to leave people with the idea of is all of us ought to be informed patients, and we ought to demand the things that the evidence and the experts are saying need to be done. The American Diabetes Association says kidney function ought to be assessed, and it is a fair question to ask your doc. What are you doing to assess my kidney function, or aren't we going to do my kidney function testing? Patients having control and knowing how to control, I think, is critically important.
Great. So I love this question because I think it comes up a lot as a diabetes educator. My doctor recommended, whoops, I'm going to have her come online. Sorry, Lucille from Indiana. I almost asked your question. Here you go.
Yes, my question is, my doctor, I have type 2 diabetes. My physician wanted to place me on an injectable, but I have two parents that have died from cancer, one from pancreatic cancer and the other one from a glioblastoma. And I know that some of these injectables come with a black box warning related to cancer. And so I didn't know whether or not, based on my family history, if you would suggest that I use an injectable or use another option.
So that's I'm getting asked, or we're getting asked all the easy questions. First of all, my sincerest condolences to you on loss of your parents and due to cancer. I love the fact that you've done a little bit of study. I love the fact that you have a sense of what your family history is. And I think my advice to you would be to have a conversation with your healthcare team, the physician and everyone else, and
discuss the yeah.
What exactly is in that black box warning? I'm on the phone now. I got
that's smart. Making
So we still can't hear you on the phone bridge.
Oh.
So if you turn off your computer, microphone and just go to the phone bridge is what I do. And Starlin, go ahead and give your say while he's getting back on.
Well, he's saying, and discuss those black boxes with the physicians that are involved, and look at the pluses and minuses based on those cancer. Now, pancreatic cancer is of concern, and the glioblastoma. Most of what we're concerned about is that thyroid area. So thyroid. Is he coming in? With thyroid cancer, which but being attuned to the fact that both your parents had very severe cases of cancer that
Oh, we're losing you too.
Yeah, so it's Eduardo. I'm on the, there we go.
There we are.
There we go.
Okay, can you hear me?
Yeah.
Okay, so okay, now doctor's back. So Dr. Sanchez, I just kind of filled in about discussing all the black box indicators with with the physician, and then talking about the pancreas versus the glioblastoma versus the thyroid area.
Because some of this is about dealing with the objective. Some of this is also about dealing with, and I'm looking down at my phone, I apologize, about dealing with just very legitimate concerns that ought to be addressed. So I think it's a great question. The other is there are other options, and maybe the other question is, what are the options available to manage your glucose? Does it have to be a particular class of drug versus another class of drugs? And have a conversation about all the options that minimize the risk on the one hand and minimize your level of concern on the other hand. Both of those are critically important and worthy of consideration.
Thank you. If you could use support throughout the year, there's a few resources you might want to check out. One is Living with Type 2 Diabetes program, where participants receive information through email and booklets that provide support and information on emotional health, eating healthy, and physical fitness, tips on managing and living well with type 2 diabetes, as well as opportunities for support online and in your community. The link to sign up is on our registration page, diabetes.org/experts. Okay, so we have a question coming in online from Elizabeth. I am a diabetic and I am breastfeeding my 10-month-old. Are medications safe while nursing? And what can I do to lower my blood sugar and diet while breastfeeding and nourishing my son? Do I need extra vitamins? Either one of you?
So I'm going to jump in. I think Starlin and her role is probably most appropriate. There is the mother's got to be healthy in order for baby to be healthy. My presumption is that those are conversations, depending on the medications we're talking about. They're probably safe to be used. I'm going to use the word probably. This goes back to, I think these are conversations that individuals ought to have with their healthcare team about the specifics, not only is this safe or not, but to address what might be some anxiety-provoking thoughts and questions regarding the very issue that you're talking about. But Starlin, you are going to know a whole lot more about this than I.
Well, thank you, doctor. So again, I'm going to go back to that team. So if she she probably had a gestational diabetes expert while she was pregnant. And it would really be good to know the kind of medications, because if they handled her with insulin through that process and then postpartum baby insulin, then that's one thing. If she's only taking metformin, then again, it's what you said. It's very safe. When we get into the higher classes of medications that may or may not have studies done in those postpartum women that are breastfeeding, but I have a 4-inch book on just all the medications that have been tested that are in that classification for breastfeeding. I have twin girls myself, and the oldest of the twins were breastfeeding, and I had gestational diabetes and she had gestational diabetes. So she breastfed all the way through. We used a little bit of insulin toward the end with her and was able to move her off the insulin, and she got back into exercise shape and didn't have to start the metformin. So again, not knowing the exact medication she was put on, whether she's a type 1 or a type 2 or a type 2 gestational, would have been helpful. But again, your physician and your health team are going to know there's great resources on this, and we'd be happy to help you.
So I think the other person that we so often forget, and you will appreciate this, Darlin, is the pharmacist. Ask the pharmacist. If you question the medication you're on, ask the pharmacist. They are going to know more than anyone else on the team about that medication. So don't hesitate to ask your pharmacist.
We have very
That's so
sick
great.
folks. And
I just had the thought about that we hadn't explicitly talked about pharmacists as a member of the health team. And Starlin, you know the data probably better than I do, that when pharmacists are engaged in the health team, outcomes are better for both diabetes and hypertension management. We need to do a better job of engaging and making pharmacists a part of that healthcare team. I'm a person who wishes people didn't have to be on medications, but that's a wish. That's not a reality. And so it's a combination of lifestyle plus pharmacological agents when necessary. Pharmacists are so important.
Thank you.
Great.
Thank you so very much. The other thing she asked was, should she be on a vitamin? And normally you stay on your prenatal vitamins through breastfeeding so that you can have all those. You're ravaged. You're making all this milk to feed your baby, and so you need a very good diet. And most of the time we stay on those prenatals if we can afford it.
Perfect. So I do have a writing question. I think I'll answer this one. How does one go about getting a medical team put together? So we've talked about the team quite a bit, but I think number one, I would ask you, you wrote in that you got a prescription, an hour with an educator and a follow-up blood work. I would go back and make a phone call to that educator and see if you can have an extended visit. Also, if you get either on the American Diabetes Association website, they have programs that are available in your area that have teams that teach about all kind of the ins and outs of diabetes. And also the American Association of Diabetes Care and Education Specialists also has a long list of programs in your area. And if you find you can't find one in your area, though you certainly, you're in Littleton, Colorado, you should have one. And the Barbara Davis Center is one of the best in the world. So, and they're now doing adults as well. So that would be another place you could give them a quick phone call and say, I just need more information. So that wraps up our last question. And so, Dr. Sanchez, you want to give one important tip that came out of today that you feel everyone should remember?
I think one important tip is cardiovascular disease and diabetes are inextricably tied together, and you have the keys to improve your life and make it longer and healthier. Life's Essential 8. You can find out all about it at heart.org.
Perfect. And Starlin, you too. What's the one big take-home message from today?
There's a team to help you, support you through this long process, and we want to be able to be at your service, help augment what your physician is doing, work with the diabetes educators. I am a diabetes educator on top of being a pharmacist. Many of us are, and so we work in that team-based care with the exercise physiologists. I mean, we probably can name 20 people that are really part of the team. So I don't want to leave anybody out, but we are here for you to access. And if you go to your local pharmacy and ask that pharmacist, if that person isn't able to do it, they're going to know where to send you, because we have diabetes centers all across the nation where they're practicing team-based care. And you can put your own team together. You can use your own family practice doctor, your own friendly pharmacist, your own, you can pull it together as you need to do it. And the diabetes educator, the Association of Diabetes Educator, and the American Diabetes Association and the American Heart Association is working on building the strength of that team to help you.
Great. To help you feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor and dietitian and the rest of the team about your pharmacist about your risk for heart disease, stroke, and kidney disease. Go to knowdiabetesbyheart.org and learn more. Register for our next event on diabetes.org/experts. Sign up for diabetes education near you. There you go with that one. And sign up for ADA's free Living with Type 2 Diabetes program. Links to these resources are on diabetes.org/experts. Thank you for all your great questions you called in and wrote in with. We're sorry we were unable to get to them all during the live Q&A. If you have questions about this event, you can contact us via askada@diabetes.org or calling 1-800-342-2383. Thriving with Diabetes takes a village, and we're here to support you. Special thanks to our experts, Dr. Sanchez and Starlyn Hayden Greeting. I am Carla Cox, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you at our next events, August 9, Transition of Care, and September 13, Neuropathy and Peripheral Vascular Disease. Please stay on the line for a few minutes, and we invite you to take part in our brief 13-question survey, which will help us plan for future events. If you have any questions about the event, please email askada@diabetes.org and include Ask the Experts Q&A in your subline. Thank you for joining us. And now we'll launch into our quick survey. The Experts event. We hope that you benefited from your experience. Please stay online to complete a survey about this event. Your valuable feedback is essential for us to reach our program goals and improve future events. All responses will remain confidential. So here we go. Question 1. Please rate the extent to which you felt the event met your expectations. For did not meet my expectations, press 1. For somewhat met my expectations, press 2. For moderately met my expectations, press 3. For met my expectations, press 4. And exceeded my expectations, press 5. That's question number 1. Question number 2. After attending this event, do you plan to attend a future Ask the Experts event? Press 1 for yes, press 2 for no, and press 3 for not sure. Question number 3. Please rate your agreement with the following statement. By attending the event, I gain knowledge on the presented topics. Press 1 for disagree, press 2 for somewhat agree, press 3 for neither agree nor disagree, press 4 for somewhat agree, and press 5 for agree. Question number 4. Please rate your agreement with the following statement. The knowledge I gained is relevant to my loved one's diabetes. Press 1 for disagree, press 2 for somewhat disagree, press 3 for neither agree nor disagree, press 4 for somewhat agree, and press 5 for agree. Now we'll repeat that question. Please rate your agreement with the following statement. The knowledge I gained is relevant to my loved one's diabetes. Press 1 for disagree, press 2 for somewhat disagree, press 3 for neither agree nor disagree, press 4 for somewhat agree, and press 5 for agree. Question number 5. Please rate your agreement with the following statement. I feel confident that I can apply the knowledge I gained to help manage my loved one's diabetes. Press 1 for disagree, press 2 for somewhat disagree, press 3 for neither agree nor disagree, press 4 for somewhat agree, and press 5 for agree. Again, the question is, please rate your agreement with the following statement. I feel confident that I can apply the knowledge I gained to help manage my loved one's diabetes. Press 1 for disagree, press 2 for somewhat disagree, press 3 for neither agree nor disagree, press 4 for somewhat agree, and press 5 for agree. Question number 6. Please rate your agreement with the following statement. I intend to use the knowledge I gained in a new or future appointment with a healthcare professional. Press 1 for disagree, press 2 for somewhat disagree, press 3 for neither agree nor disagree, press 4 for somewhat agree, and press 5 for agree. That question again, question 6. Please rate your agreement with the following statement. I intend to use the knowledge I gained in a new or future appointment with a healthcare professional. Press 1 for disagree, press 2 for somewhat disagree, Press 3 for neither agree nor disagree. Press 4 for somewhat agree, and press 5 for agree. And I think I just said that question twice, but here we go. Question number 7. Please rate your agreement with the following statement. Attending the event promoted my feelings of belonging and community. Press 1 for disagree. Press 2 for somewhat disagree. Press 3 for neither agree nor disagree. Press 4 for somewhat agree, and press 5 for agree. So that question again. Please rate your agreement with the following statement. Attending this event promoted my feelings of belonging and community. Press 1 for disagree. Press 2 for somewhat disagree. Press 3 for neither agree nor disagree. Press 4 for somewhat agree, and press 5 for agree. Question number 8. Before participating in this event, how confident did you feel speaking with a healthcare professional about your loved one's increased risk for heart disease and stroke? Press 1 for not at all confident. Press 2 for not very confident. Press 3 for neutral. Press 4 for somewhat confident. And press 5 for very confident. And again, question 8. Before participating in this event, how confident did you feel speaking with a healthcare professional about your or your loved one's increased risk for heart disease and stroke? Press 1 for not at all confident. Press 2 for not very confident. Press 3 for neutral. Press 4 for somewhat confident. And press 5 for very confident. We strive to create programs and services that represent the full diversity of ADA community. We are asking the following questions about demographics to ensure that we are meeting that goal. So our next question is, please select which of the following best describes you. Press 1 for a woman. Press 2 for a man. Press 3 for non-binary. And press 4 for I prefer not to answer. So once again, please select which of the following best describes you. Press 1 for woman, press 2 for man, press 3 for non-binary, and press 4 for I prefer not to answer. And then our final, 2 questions left, sorry. Please select which of the following best describes you. Press 1 for silent generation, born between 1928 and 1945. Press 2 for boomer, born between 1946 and 1964. Press 3 for generation X, born between 1965 and 1980. Press 4 for millennial, born between 1981 and 1996. Press 5 for Generation Z between 1997 and 2012. And press 6 for I prefer not to answer. So once again, the question is, please select which of the following best describes you. Press 1 for silent, born between 1928 and 1945. Press 2 for the boomer generation, born between 1946 and 1964. Press 3 for Generation X, born between 1965 and 1980. Press 4 for Millennial, born between 1981 and 1996. Press 5 for Generation Z, born between 1997 and 2012. And press 6 for I prefer not to answer. And our final question, please select which of the following best describes you. Press 1 for African American or Black. Press 2 for American Indian or Alaska Native. Press 3 for Asian or Asian American. Press 4 for Hispanic, Latinx, or Spanish origin. Press 5 for Middle Eastern or North African. Press 6 for Native Hawaiian or Pacific Islander. Press 7 for white, and press 8 for prefer not to answer. So once again, our final question, please select which of the following best describes you. Press 1 for African American or Black. Press 2 for American Indian or Alaskan Native. Press 3 for Asian or Asian American. Press 4 for Hispanic, Latinx, or Spanish origin. Press 5 for Middle Easterner or North African. Press 6 for Native Hawaiian or Pacific Islander. Press 7 for white, and press 8 for prefer not to answer. Thank you very much for answering these questions. Please join us again at a future Ask the Experts event. To learn more, go to diabetes.org/experts. Again, that is diabetes.org/experts. And a final thank you to our wonderful speakers and for all of you attending.
Thank you. Thank you.